Hey everyone, Drew back here at VCS 2017 at the IM3 booth, joined by Dr. Nuveen from Oklahoma. Thanks for joining us.
Welcome.
How's your show going so far?
Good, good.
What are some of the sessions that you've attended, some of your favorite sessions? I know it's early, but any favorite sessions so far?
Well, I've been in practice for 14 and a half years, so it's challenging for me to find a course or a speaker that I don't have more experience than.
Okay.
So the nose section had a few speakers that have done even more than I.
Okay, cool.
Which is nice.
What from that session, what some specific things that you learned that you might not have known?
Oh gosh, it would be hard for me to put it into normal language.
Right. Okay.
But I would say that a few of the techniques that they presented were ones that I have tried, and they confirmed that they work.
Okay, cool. So validation, I was going to say. So you've got a lot of experience, and then probably a lot of this for you is validating some of the work you've already done, or...
Yeah, it's nice to... the problem with working in a private office, as I do, although a large office, and I have lots of doctors that visit from all over the world, the biggest problem is isolation. So if you stay within the walls of your practice and just do what you think is best, it may not be best. So you have to go outside those walls and go into territory that you might be uncomfortable because someone's telling you something that you figure you should know.
Right.
So you have to push yourself, and otherwise you just stay in an isolated area and maybe not provide the best care.
Yeah.
So coming here allows us to do that.
Cool. Is this your first time at this show?
No, I've been to this show 3 times.
How does this compare to other shows, being multi-specialty versus just maybe exclusive?
Oh, my goodness. Now you've really hit on a good one. Well, it's actually disingenuous, to be honest with you, because there are a number of specialties that they do participate with, but they're not all inclusive. There's a number of other specialties that participate and actually not only participate, but have established and created incredible advances within the science of cosmetic surgery that have nothing to do with the groups that they are inclusive to.
Okay.
So it's very frustrating for me. Planet Fitness.
Yeah.
Planet Fitness has a mission and a model that they are all inclusive, non-judgmental. Horse poop. It's garbage. They've got criticisms of people on the walls that if they wear a tank top and make grunt-like noises, which has been otherwise proven to be effective in increasing muscle strength, athletic performance. That's why tennis players yell. It's absolutely false. And so I like to point out that if they were all-inclusive, it would be better for this group.
Okay, gotcha. I like it. Thanks for sharing that insight.
You're welcome.
So tell us a little bit about your practice, and we already learned a little bit about from your partner in the practice about your what you guys are doing. But what are some of your favorite procedures, cosmetic procedures that you like to do?
Well, I would answer in 2 ways. The highest volume thing I do is breast and abdomen surgery. I do about 700 cases of that a year, and then noses, facelifts, and facial rejuvenation is my passion.
Okay, cool.
But I do far less of those.
Okay, gotcha. So you would, that's a lot of cases, 700 breasts, you said? That's a lot. So you want to get more of kind of the facial stuff going?
Well, I can honestly say,
would you have time?
as I previously, as far as coming here to the meeting, I mean, I don't know if there's anybody here that's ever done as many surgeries as I have in breast and abdomen surgery. So
I was going to say
that's hard to learn from. But the nose and face cases, there are people that do more than I.
Cool.
So that's what I'm seeking to get out of here. But as far as affecting my practice, it's really just little tiny things. You know, I'm sure you guys, if you went to a meeting on your area and marketing expertise, and if you got one valuable tool out of a week, you'd be like, yeah,
totally,
that's gold.
No, you're exactly right.
Yeah.
Hey, you hit on an interesting point. Would you recommend for a cosmetic surgeon or any kind of surgeon that's just getting into practice versus, because it sounds like you've done 700, say, of the breast and abdomen procedures versus a little less of the facial. Would you recommend that maybe someone just focuses on one procedure or one part of the body first so they can get that number up there to be good and then move on to the next, or kind of hit them all at once?
Well, it all comes down to personalities and life goals. If a person's ambition is to be an expert, you can be an expert and still do other things.
Sure.
Diversity is the spice of life, and
Yeah.
and without that, I would not do this job. I mean, there has to be some element of something new and different.
Right.
So to do exclusively noses would not be what I would seek to do.
It wouldn't be satisfying.
Not at all. Yeah. Not at all. So the full range of what I did my fellowship in is cosmetic surgery. So liposuction, breast lifts, tummy tucks, eyelids, facelifts.
So you're going after all of it.
Yeah. Now, does that make me less of an expert? Well, that's why I come to a meeting, to see a person that does focus perhaps on one aspect.
Yeah. All right, cool. Well, let's shift gears here a little bit.
Sure.
I'm going to ask you some personal questions, get to know you a little more, and your patients can know you a little more. What's your favorite color?
Lavender.
Nice. What's your favorite sport team?
Oklahoma State Wrestling.
Nice. Were you a wrestler?
I was.
Cool. Did you wrestle in hhigh school and college?
I did.
Cool. Where'd you go to college?
Lafayette College in Easton, Pennsylvania.
Okay, beautiful.
Smaller college than my high school.
Where are you originally from?
Pennsylvania.
Okay. My parents lived in Lansdale for a little bit. I'm originally from...
I live 15 minutes from there, Doylestown.
Okay, yeah. I'm originally from Connecticut, so right there. Okay, why'd you get into cosmetic surgery?
My father was an orthodontist, and when I was 6, I asked him about all the pictures he had on his wall in his office, and they were typically of adolescents having their teeth straightened. And he provided for a good lifestyle, and he loved his job and did it for 38 years. And the teeth were an impressive, and I still feel probably the most impressive part of a personal enhancement.
Right.
And I would often ask him, well, what about their nose? And my dad would say, well, I don't do that. And that's who I wanted to be.
Gotcha. Cool. So tell us a little bit about your story. And I know a little bit about how you got into cosmetic surgery. You originally started as a oral maxillofacial surgeon, right?
Yeah, my goal was always to do cosmetic surgery. Since I was 16, I made a very detailed, absurd, obsessive life plan.
Nice.
And so my plan was to go through dental school in part. My twin brother is a dentist now. He's an orthodontist.
Okay.
My father was a dentist and orthodontist. And so I wanted to go through dental school, medical school, surgery. I did...
so you did go to dental school too?
Yeah, I did 8 years of residency and then a fellowship.
Wow. That's a lot of school.
Yeah. And then the fellowship I did was in cosmetic surgery. It was the busiest one in the country at the time. So.
Great. Okay, last question. If you could be any kind of animal, what would you be?
A poodle.
Poodle, nice.
Because I have one.
Why? Why else besides that?
She's the happiest thing that's ever existed at all times.
They're really smart too, right?
They're supposed to be, but this one, no, she missed that post. Yeah.
She didn't get that genetic
memo.
trait.
That's right. No,
cool.
She's a cute dog, though.
Awesome. All right. Well, thanks for joining us.
Pleasure.
I really appreciate it.
Thank you.
And have a good show.
Thank you very much.
You got it.